Hi, so this is Dr. Aidoo of the Department of Anatomy and Cell Biology, School of Medical Sciences, University of Cape Coast. I want to take you through a few questions to test yourself on brain and spinal cord. So this is really for you to assess your own self to see whether you have actually laid a good foundation in your knowledge in neuroanatomy. We want to first look at injuries and lesions to tracts. A tract is the same as fasciculi or funiculi or pathways or axons. So lesions of the anterior and posterior roots. What will be the signs or symptoms in each case? So lesions of the anterior and posterior roots. So you are looking at the spinal cord level. The roots as in the afferent fibers entering and the motor fibers leaving the spinal cord. Okay, so at the point where they enter or leave, they form roots. So these are the sensory and motor fibers we are talking about. So for the posterior root, which is actually sensory, you are going to have pain in the area of the skin innervated by that root, not felt by the individual. And then for the anterior, which is motor, you are going to have paralysis of muscles supplied by that root. Okay, so lesions of the lateral spinothalamic tract. What will happen to an individual who has a lesion to the lateral spinothalamic tract? Well, for this question, you have to understand what modality or sensory impulse this tract is carrying, spinothalamic. So that is pain and temperature, right? So symptoms. We're going to have contralateral loss of pain and temperature below the level of the lesion. Contralateral means that we know the first order neuron enters the spinal cord and synapses with the second order neuron on the same level of the spinal cord. So if there's a lesion on that level of the spinal cord, it means that all the spinal cord segments below that point, the fibers that were coming and being transported upwards towards the brain would have already crossed. Okay, so that is why you're going to have contralateral. Okay, and even on that same level of the spinal cord, because it's also crossing on the level of the spinal cord, it's going to have contralateral loss of pain and temperature. So lesions of the anterior spinothalamic tract, So you should know that this is relating to what pressure. Okay, it's a pressure pathway. So symptoms, you are going to have contralateral loss of touch and pressure sensation. That is, the patient will not feel the light touch of a piece of cotton or pressure from a blunt object on the skin. Injuries to fasciculus gracilis and cuneatus. And you remember that these fasciculi will occupy the posterior column of the spinal cord. Posterior column, fasciculus gracilis, and then cuneatus. So what will be the symptoms? There's no muscle and joint consciousness. The individual has no idea of the position and movement of the ipsilateral limbs below the level of the lesion. So this is ipsilateral because they don't cross at the level of the spinal cord. Which level do they cross? They cross at the level of the medulla. Okay, and then they move to the midbrain as the medial lemnisci. So there's no muscle and joint consciousness. So we are talking of proprioception, conscious proprioception will be lost. So you don't know where your joints are in position in relation to space and then the environment. You don't know whether you've lifted your arms up or legs up or they are still on the ground and whether you are bending or whatever. So that sensation will be lost. Then also when the patient closes the eye, they are unable to tell where the limb or part of the limb is in space. Okay, and then also the patient has impaired muscular control and movements are jerky or ataxic, so the movements are not well coordinated. There's loss of vibration sense below the level of the lesion on the same side. There's loss of vibration sense, so you lose your vibration sense. Then there will be loss of tactile two-point discrimination on the same side of the lesion, because this region, the posterior column, is responsible for conscious proprioception, two-point discrimination, and therefore you are going to lose this. What is the estimated distance in the palm and dorsum of hand to appreciate two-point discrimination? So palm is between 3 and 4 millimeters, and then the dorsum at the back of the hand will be 6 to 5 millimeters. Beyond this, you will not be able to tell the estimated distance as being 2 points. What is tabes dorsalis? It is caused by syphilis and destroys the dorsal root at the point of entry into the spinal cord. List all signs and symptoms in your book. So you need to do a very genuine and transparent work. We look at upper motor neuron lesions. So we have upper motor and lower motor neuron lesions. So the upper motor neuron lesions are the fibers that are emanating from the prefrontal gyrus, okay, carrying motor fibers all the way towards the spinal cord. So that first order neuron that has not yet synapsed, we call that the upper motor neuron. Once it synapses and there's a second order neuron taking over, that becomes a lower motor neuron. So when there are lesions in the upper motor neuron, what are the symptoms that the patient will present with? You have Babinski sign, so there will be positive Babinski sign. You also have superficial abdominal reflexes. You have cremasteric reflex. You have also loss of fine-scaled voluntary movement. So you should know what all these mean. The Babinski sign, where you have the fanning out of the toes and then the dorsiflexion of the big toe. Then lesions to extrapyramidal tracts. You have severe paralysis, spastic paralysis, hypertonicity, exaggerated deep muscle reflexes. So all these are examples of lesions to extrapyramidal tracts. Then if you have a lower motor neuron lesion, you are going to have these characteristics: flaccid paralysis, atrophy, that's muscle atrophy, because the muscle is not being affected, it's not active. Then loss of reflexes, muscle fasciculations, and then muscular contracture. Should be able to explain the following terms: hemiplegia, monoplegia, diplegia, paraplegia, quadriplegia, hypotonia, hypertonia, dystonia, which is related to the lentiform nucleus, then chorea, corpus striatum affected. The lessons on lentiform nucleus and corpus striatum has been covered in another video. You can look at that. I want to thank you for your attention, and I hope this video helps.